Today, World Mental Health Day, as we've been talking about here, and according to the World Health Organization, the pandemic is taking a toll on our mental health, with both anxiety and depressive disorders increasing. Get this, more than 25% during the first year of the pandemic. This is all in part due to severely disrupted mental health services and a widening gap for available treatment. There's a recent study by the Aakoma Project, an organization that empowers youth and families to seek help and manage mental health, shows that youth of color, yes, are even more disproportionately affected. Let's bring in now psychologist and founder of the Aakoma Project, Dr. Alfiee Breland-Noble. And I saw that nod when that name, Accommen Project. You're very proud.
Yes, I am.
Look, very proud of the work, but this is necessary work. Why? You know what? Talk to me about that for just a moment. The pride you have in this work, because there seems to be so much more work that needs to be done in this area.
Yeah, well, Dr. Jen and I were just having a quick conversation, and part of what's really important to me about this work is that we spent so many years understanding mental health from the perspective of just one group, right? And it's important for us to understand the mental health needs of white youth. We also need to understand it for the wide variety of kids of color. And I always talk about intersectional kids of color. So in addition to being kids of color, there are also kids of color with disabilities. There are also kids of color who are LGBTQIA+. And so our goal at the Accommen Project is raising consciousness, empowering people, and changing that system.
Okay, the why. Again, look, we've seen this in almost every facet of our society, that people of color are more disproportionately affected. So what are you seeing? Give us an idea of just how disproportionately kids of color are impacted when it comes to mental health.
Absolutely. So we know from our data that about 50% of the youth of color that we surveyed, 2,900 young people, are struggling with anxiety, right? And so given that they're struggling with anxiety, what are some of the things that are impacting them? Well, racial trauma is impacting them, right? And so there's not to say that white children don't or are not impacted by racial trauma, but we've got to be able to talk about these things. This is something new in terms of talking about racial trauma that we haven't historically had the opportunity to discuss for that population. So that's part of the why. They're also disproportionately impacted by COVID, right? The losses that they're experiencing of loved ones, the impact of financial losses. So these are the kinds of things we've got to be prepared to have conversations about if we want to try to address these young people's needs.
And Dr. Alfiee, we've spoken on this show so many times about the need to look at the same disease, in this case, mental illness, differently in different populations. And so the Aakoma Project did that. I looked at the report. I was so impressed by it. You know, you mentioned over 2,000 youth of color that you studied. And I want to go through some of the results that you found, the statistics, because I think they are jaw-dropping, to say the least. 50% experience severe to moderate anxiety. Almost 27% reported a suicidal ideation, and 18% made at least one suicide attempt. What was your reaction when you saw that? Did you expect that? Were you surprised? And now, what is the call to action that we can do something about this?
Yeah, so I wasn't surprised because I know what I see, and over the years what I have seen in clinical practice. I also was not surprised because of what I hear when we're out in public doing the work. What surprised me, and continues to surprise me, is that we were one of the first to even collect this kind of data, right? And so that's the thing that really kind of grabs me. And I think the call to action is for us to collaborate with organizations who are trying to work with these young people, right? Like the Accommen Project. There's so many out there, Black Men Heal, Asians for Mental Health, who are trying to do the work. And I also think, you know, working with this organization called Choose Kindness, the Choose Kindness Project, being able to do the kind of work through a collaboration of organizations who are invested in the mental health of all of our young people, that's a call to action. And one quick call to action is for parents and caregivers to check in with their kids regularly. That's simple, but not enough of us do it.
You say check in with your kids there, but what? And I know you do the work, and you have so many other organizations you know that do the work, and you wanted to shout them out there. But how much of an issue is access to mental health care? Yes.
So access. What people think about when they think of access to care is that people don't have money or they don't have insurance. That's a part of it. But more issues related to access to care have to do with logistics. What time is the clinic open? Do you need to take off work to take your child to the clinic? Are you going to lose money if you take off work to take your child to the clinic? There are things like stigma. Stigma is huge in communities of color, right? And so it's the idea. I remember a study we did years ago. We had a mom who said, I'm already Black, I'm already a woman, I don't also need to be crazy, right? So there's this personalized stigma. Publicly, we'll all say therapy is amazing, everybody needs to go. Not many of us internalize that and say, I need to go, and that's what we have to work on.
All right, Dr. Alfiee, we thank you so much for your time and your work. And please, I know it's World Mental Health Day. We should have you back plenty more to have these discussions. We don't have to wait for a day. Okay, thank you so much. And folks, we do want to remind our viewers, if you are experiencing suicidal thoughts or substance abuse or other mental health issues, please call or text the 988 Suicide and Crisis Lifeline. You'll reach a trained crisis counselor for free. This is 24 hours a day, 7 days a week. You can also go to 988lifeline.org. Dr. Alfiee, I cannot thank you enough. Thank you so much for being here.
Thank you, my pleasure.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.